Good morning, everyone. This is Michelle Scott with the California Healthcare Interpreting Association. Welcome to this webinar called Memorization and Note-Taking with Certified Interpreter Lourdes Serna. This webinar is the sixth in our new monthly webinar series offered by the CHIA Education Committee. I'll be hosting today's webinar, and first we'd like to review a few items. This webinar is being recorded, and the recording will be posted to CHIA's YouTube channel immediately following the webinar. And in just a moment, I will show you that YouTube channel so that you know that you're looking at the right one if you try to find this recording. And we would love it if you share the YouTube link with your colleagues and, of course, subscribe to our YouTube channel. If you'd like to receive a certificate of attendance for the webinar, you must stay connected to the webinar for the entire presentation. You also need to be signed online using the link that was sent to you in the email in order to get the certificate of attendance. We cannot send certificates of attendance to anybody who is attending only by phone because the webinar platform does not have a way to track that attendance. It only can track you if you've signed online. We also cannot issue any certificates for people that are watching the recording of the webinar, although we do encourage you to do so and share that. The certificates of attendance are issued by CHIA, not by the trainer. We do request that you give us 30 days in order to process the certificates. The CHIA Education Committee is made up of all volunteers, so that is why we do appreciate your patience in order for us to process and email over 100 certificates. And on that note, we are always interested in having new volunteers for the Education Committee. So if that's something that sounds interesting to you and you have a couple of hours every month that you would like to participate with CHIA, you can send an email to info@chiaonline.org. During this webinar, you are welcome to use the questions box to submit any questions or comments to the trainer. I will be moderating those questions and sending those to Lourdes and telling her what your questions are. We will be doing the question and answer session at the end of the webinar, but you are welcome to send your questions and comments as soon as you think of them. We do welcome your feedback for the webinar. You'll have two options to complete a survey. The first is that a survey will launch on your screen immediately following the webinar. If you don't have a chance to do the survey at that time, then you will receive an email tomorrow with a link to the survey. Even if you finish the survey online, you will still receive that email. So don't think that you have to complete the survey again or that we didn't get it. It's just something that's automatically generated by the webinar platform. We would like to invite you to use social media and use the hashtag CHIAwebinar whenever you're posting about today's event. And we have a couple of other hashtags that you might want to use there as well. And we always appreciate if you put @CHIAPresident there, and that's a nice way that our president, Jose Garcia, can see your posts and share them as well. And I want to note that Lourdes has put some handouts. She has 5 handouts for today's presentation, so you're welcome to download those and use those for reference during the presentation today or at any time. She's going to be explaining those and going through them. But I just want to let you know now so that if you want to go ahead and download those handouts from the webinar platform, you can do so and have them ready. So it's now my great pleasure to introduce today's trainer, Lourdes Serna. Lourdes is a certified medical interpreter. She has been a Spanish interpreter and trainer with more than 30 years experience in healthcare interpreting. She has worked as a staff interpreter in both in person in both private and county hospitals and clinics, a freelance interpreter covering workers' compensation assignments, and an over-the-phone and video remote interpreter. Ms. Serna has taught medical interpreting at several colleges and currently teaches a 40-hour training curriculum for an agency. She's a native of Guatemala, and we are so happy to have her on the board of directors for the California Healthcare Interpreting Association. I've had the great pleasure of knowing Lourdes myself for a few years, and if you ever come to the CHIA conferences, which of course we hope that you do, you will see Lourdes' smiling face greeting you right there at the registration desk. That's where she loves to be there and greeting everyone. And you can see her picture now and look for Lourdes when you go to a conference or another CHIA meeting. And I'm going to now show you the website for CHIA. So this is chiaonline.org. For any of our events, including the conference, the webinars, or any of our on-site trainings, go to chiaonline.org and you will see the information right there on the home page for any of the events that are upcoming. We also have the events page here that you can see upcoming events. You can register from there. You can also see past events. So if there's a topic that you're interested in having in your geographic location or at your agency, you just get in touch with Beverly Truman, who is currently our chair of the education committee, and we can get those trainings set up. You can also click here on education and certification and get more information about all of the wonderful programs that CHIA has to offer. And I mentioned that I would show you our YouTube channel. And just to let you know, there are 2 YouTube channels for the California Healthcare Interpreting Association. This is our new channel, however, and this is the one where you will find webinar recordings. So please do subscribe. You'll see that in the title it does say new there. And right over here on this red button, that's where you click to subscribe. And that way, if you happen to miss any of our webinars, you will still be notified by YouTube once those recordings are popped up. So now it is my pleasure to turn over the presentation to Lourdes. All set, Lourdes?
All set. Thank you.
Okay, very good. All right, go ahead.
Thank you. Good morning, everyone. It is my pleasure to be here this morning. I hope all of you are doing well. I will be, today I will be dwelling on some topics that for us are very, very important because without memory, it's very, very hard to really interpret. I have had the privilege and the pleasure of training several interpreters, and one of the things that they most sometimes complain about or talk about is how to develop your memory and how to remember the messages that we receive so that we can interpret them back. So I wanted to first start with the human brain. And the human brain, it is the hard drive or the center of the nervous system. So as we all know as medical interpreters, the brain is a complex structure that controls all the activities of the human body: digestion, breathing, heart rate, walking, and movement of arms, and so forth. So the brain is actually the computer of our body, and we interpreters are very, very interested on how the brain works so that we can work and understand and realize that memory is a tool that we need to become a very effective interpreter. So here's just some information as to how the brain and the language interact.
Excuse me, just one moment, Lourdes. I'm sorry to interrupt you, but we're not seeing your screen yet.
Okay, so thank you. Let me. Okay, is it there now?
Perfect. Yes, thank you.
Okay, thank you. People that know me will say that I'm very challenged by technology, so thank you for letting me know. I appreciate it, and I apologize. Thank you. So here's some of the aspects of the brain. I would say that of interest to interpreters, I would say that the brain interacts with one half of the body, but the connections are crossed. So the left side of the brain interacts with the right side and vice versa. And that's something that, we all know as interpreters, but just a reminder. As I interpret for patients who have had strokes, on the left side, it's hard for them to understand why their right side is affected and not the side that was of the stroke. So as we interpret, we understand that the brain can develop new cells throughout our life. And and the brain, it can always be stimulated. And the five primary areas that stimulate the well-being of the brain are, as you know, networking. So sharing with other people, getting new ideas, that makes the brain like gymnastics, going to the gym. Mental stimulation, reading, doing crossword puzzle, echoing, all kinds of things that stimulate the brain. I'm not sure if you know of the study that was done in England some years ago, where they actually did a study of the brain of an interpreter as he was interpreting, and the brain lighted like a Christmas tree when the languages were going back and forth. So stimulating the brain really does help us stay in shape, have the brain stay in shape so that we can interpret spirituality. I'm not saying religious spirituality, just having and I do have a handout on this that you may enjoy. The handout is called Walking Mindful Meditation, and it will just explain how to keep the brain nourished through these activities. And then physical activity is always very good for the brain, and nutrition. Nutrition, very, very important for the brain, so that when we try to interpret, our brain will be healthy. So networking, as you see, there's a round of friends here talking. So communication, as we said before, sharing ideas, rational thinking, creativity, emotions, expressions, identity, all of those things help the brain get stimulated and helps us develop better brain function so that we could interpret better. So these are some ideas for mental stimulation, creativity and innovation. And sometimes people like to do crafts or write notes or sewing. All of that is so important. And also mental stimulation helps the process of emotions. And then, as you know, nobody knows everything. We learn through our entire lives, and that helps us keep a healthy mind. So going to the issue of spirituality, um, that's a very important part of having our brain nourished and developed. And like I said, there is a nice handout for your viewing. And this is, it says walking mindful meditation. Here's how to practice mindfulness. And it will just give you an idea as to if you don't already practice mindfulness. It really does help when we are interpreting. And the reason why I put this in there is because many, many times as I teach interpreters or I'm interpreting myself, I've noticed that sometimes interpreters are anticipating what is going to be said, or they're anticipating a response, or they got caught with the word that they're with, so they forget and they get nervous and then they forget half of the message. So practice mindfulness and being in the present will really help us develop those skills of really being present as we interpret. Also, physical activity. Physical activity is quite good for the brain. Those of us that do over the phone interpreting or video remote interpreting, it is very important that we at least get up every 2 hours and just walk around and really let the body move before we get back on the line. Because I have experienced myself when I've been on the line for, I once had a call that lasted 3.5 hours. With those calls that are so long, sometimes I think the brain loses elasticity and the accuracy may not be there. And so it's important to move around, as especially for those of us who do over the phone or video remote interpreting. So moving on to the next slide, it will tell us how important nutrition is also for the brain. Um, um, I'm just I did some research and I found that sodas, flour, and all that really does affect the brain. That it makes it a little bit slower. So having proteins, fish, especially soup, Fish is really, really good for the brain, and taking all those vitamins like our mother told us, and take those iron pills, potassium, and all that to keep our brain in the best shape possible so that we can interpret because our patients, our clients are really counting on us. So now I'd like to talk to us about memory. Now, memory is imperative for interpreters to develop a good memory. Without memory, and I have in my training years, I have seen very well-intended students that really want to interpret, but they can't remember more than two things, and they get very frustrated, and sometimes it's very hard for them to interpret if they cannot remember past my stomach hurts, and they don't remember why the stomach hurts and so forth. So I like to just give you some suggestions on how memory works and how to help us with memory. I also have a handout that is there that's called Memory Development Exercise Handout. And if you like to see it, Michelle and I were going to do a demonstration, Michelle, of this.
Yes, I'm ready.
So okay, so would you read the instructions so that when they do it at home, they'll know how to do it?
Yes, and let me open this up here myself. So,
Okay.
so there have been a few questions about where to find these handouts. You should be able, for anybody that's looking for the handouts, you can go to the little control panel that you have for the webinar. If you're not seeing it on your screen, there should be a small blue flower-looking icon in your tray, and you click on that, and the little control panel will open up, and look for the handouts tab. And then you should be able to download those. If you do have any trouble opening or downloading, that you may need to go to the GoToWebinar support area, because everything, as far as I know, everything should download and print just fine. So we have here, we're looking at the handout called Memory Development Exercise Handout. And the instructions say, do this exercise in pairs. Choose one person to be the reader and one to be the repeater. The reader will read sentence number 1 and pause to let the repeater repeat the sentence in English. The reader will then correct any errors in repetition. Then the reader will go on to number 2 and read both sentences. Again, the reader will pause to let the repeater repeat those sentences, then correct those repetitions and go on to number 3. Continue this way to the end of the exercise. So we're not going to go through all of them. We were just going to
No.
couple, just to give everybody an idea of how this works. But one of the things I like about this, Lourdes, is that, people don't have to do it with other interpreters, correct?
Correct.
So if you have somebody at home, I think kids would love doing this.
Yes. This is a great exercise that I've done throughout my years, and I always tell my students, go back and do it with your husband, with whoever, because then they can appreciate. Because I used to know someone that would say to me, is that all you do is interpret? They didn't see the value. They didn't see what it takes to interpret.
Right.
A good memory, an ability to take notes, an ability to pay attention, to turn off the background noises, and the ability to follow ethics and know when and how. All of that is involved in interpreting. And sometimes people, they just think that because we speak Mandarin, Cantonese, Armenian, Spanish, whatever language, they think that it's already in there for us to start interpreting. And they don't realize that memory plays a big part, and knowing how and when, and sometimes have to turn the sentence around that we can give it a meaning and not go word by word like Google sometimes, So they just think that Google can do it all, and they don't realize that we have ethical principles to follow. We have all kinds of things involved in this sentence, like, oh my God, I couldn't sleep last night because I had a headache. Mm-hmm. And when we say that back into our language, sometimes we have to give it the meaning from what we received it, and Google cannot do that. It's us with our memory, with our ability to take notes, with the ability to convey feelings, and being in the present as we repeat it is what makes our interpreting um, to the best way possible. I'm always amazed as to how the patients, not even knowing us, the patients and clients, they don't know us, but they trust us the moment they meet us because the fact that we speak their language, whatever language there is, they trust us. And, I am always humbled by the trust that is placed on me by someone that doesn't even know me. But they trust me because they're saying that if they are conveying pain, anguish, or whatever they are, that I am going to convey it the way they're saying it, with the feeling and everything they said. And it's not fair that they say, my head hurts because I could not sleep last night because I had a pounding headache. And we only say my head hurts and I couldn't sleep, but we don't say the pounding headache. And that's so unfair to those that trust us. That's why I chose this topic of memory and note taking, because we have to validate the trust that's placed on us by our clients, by our patients. So, because we wouldn't like it if we were going to say something and only two things are said when I said four. So that's why I love this memory exercise and everything to do with memory and note taking.
Absolutely. And I think that what you're the point of this is not even to interpret it yet, just to say it back in English, correct? So that we're not
Yes,
even tasking the brain yet with having to render this into another language. We're just saying, pay attention and repeat and really work on the accuracy just in one language first.
that's right. Sometimes when I do this, people say, "Oh, this is difficult enough in English. Can you imagine in Arabic or Chinese, Cantonese, Mandarin? It takes a lot." So thank you. I'm ready, Misha. Would
Absolutely.
you like to be the reader and I'll repeat, or what would you like me
Oh,
to?
sure. I will be happy to be the reader.
Okay.
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 We'll do number one then. This is my baby John.
This is my baby John.
Mhm. Number two. Yesterday I took my baby for a checkup. We went to see Dr. Tran.
Yesterday, I took my baby for a checkup. We went to see Dr. Tran.
And now I'll give you the feedback. I didn't say it the first time, but you were spot on, exactly word for word what I said.
Thank you.
We'll do the third one then. So just so for anybody who's not looking at these handouts, and for those people who may be looking at the recording after the fact, you can email us and we'll be happy to send you the handouts. But for anybody that's not looking at them, what's happening is that the examples get longer and longer and bigger, so they start to build on each other. Okay, so here's number three. Dr. Tran is a specialist for children. He's a pediatrician. It was the first time we had seen him.
Dr. Tran is a children's specialist. He's a pediatrician. We are seeing him for the first time.
Okay, perfect. Now let me give you feedback and ask a question here. So you said Dr. Tran is a children's specialist. So the way I had read it was is a specialist for children. Now that seems to me that you said the same thing. Would you agree?
Yes, it's just that I got distracted and all I heard is children's specialist, so I got confused. But
That's
yes, yes,
and that's a good
yes,
point though, because we do have a lot of distractions in an assignment even.
yes, yes, we do.
And so, and then the third sentence was a little bit different, but I think, again, in my mind, you said the same thing, even though it wasn't word for word. So how do we give that kind of feedback to each other? How important is that? Because I'm also thinking, with our bilingual brains, to me, specialist for children and children's specialist is synonymous because I know how I would render it in another language. So is that okay as we're practicing this kind of an exercise? What is your advice?
I would say, that to stay as close to the line as possible. However, in reality, as you said, bilingual brain, and some of us have trilingual brain, so we're already trying to convert it, and our brain is so used to interpret that we already have it. Well, in my case anyway, we have it so that we're already trying to say it, like in my case, Spanish or Quiche, just it's children especially. So I turn it around. My brain turned it around already.
Exactly. Right.
It's which sometimes is hard to state, but I thank you for saying that, because what happens with notice is that they sometimes want to stick to word by word by word by word, and sometimes it doesn't make any sense. And so we have to give it the meaning. Now, in this exercise, we wanted to stay right, very faithful to word by word, because it was just to see how, if we remember the whole thing. And in my case, I kind of turned it around because I looked the other way, and my brain kind of twisted. But in reality, what we want to stay focused is we want to stay faithful to the meaning of the message. And sometimes interpreters, I've noticed, they get very, very frightened when they forget, like, the table is round, and then they forget the word the table, and then they get all frazzled because they forgot one word, especially the interpreters who are just beginning their practice, who haven't interpreted professionally yet. They get very frightened when they forget one word, like, for example, the word tissues and issues. The word issues in Spanish, the meaning for it, it's very few people understand it. When we say the word, excuse me for saying, but suministros, that's the word in Spanish. When we say that to our patient, it's like, what are you talking about? So they start getting very, very, their memory starts, or they start getting nervous when they don't know the word, and they may not give it, they may forget. So I always tell them, if you don't remember the word, just give it the meaning. For example, in the word tissues, tissues, or we're going to, like they said, I'm going to, the word issues, the word issues doesn't really have a translation in Spanish that will be direct, that will say, I've talked about this with other interpreters, the word issues. There's so many variations for the word issues. And the translation that I gave before was for supplies, supplies to ministers. But for issues, sometimes interpreters don't know how to say that appropriately. So we had to give it the meaning of the phrase. So that's what I meant to say earlier. I don't know if it makes any sense.
It does make sense. And I also wanted to point out that with this particular memory exercise, this is not a time for taking notes, correct? We're not practicing note taking at this point. This is just put it in your brain and really do your best to remember the longest section you can, correct?
Correct. So it's just a tool measure to see how well our memory, how well our memory is functioning. I met interpreters that said that they can remember up to 5 sentences. That is great. But when we do this exercise and we want to go to item number 7, here we have 7 sentences, and we have interpreters that can only go up to 3 or 4, and then they start missing out details. So I always like this exercise because it's a tool measure of how much can we remember correctly. That's why we like this exercise. It's this memory development exercise.
Perfect. Did you want to do one more, or did you want to go ahead and
yes?
Move on? Okay, we'll do
if you like
another one that's a little longer, and then we'll move on because otherwise we could just have fun all morning doing these exercises.
Yes.
Okay.
Thank you.
We'll do the 4th one then. First, Dr. Tran examined John. Then he asked me a lot of questions about how John was doing. He asked about how he eats, how he sleeps, and how he wets himself. He asked me about what things he can do, like smile.
Dr. Tran examined John. He asked me several questions about how John was doing. Asked me about how he eats, if he sleeps well, and how he wets himself. Asked me about what things he can do, and asked me if he likes to smile.
That was nearly perfect. The only thing was at the end, it was just he asked me about what things he can do like smile, not if he likes to smile. That
Okay.
so
Thank you.
like
Thank you. So I'm already having trouble with my memory in this in this one.
this is an excellent, excellent activity, Lourdes. I really like it, and I'm sure everybody will enjoy having some fun with this.
Yes, yes. Do it with someone that you know you love, anyone that it will give you a good insight into how your memory works and how much you can retain. And give us feedback as to how far you went. There are seven sentences here, and it's really fun. When I do this in class, everybody has a blast, you know. And when we put it in our language, oh my God, it's really fun and challenging. So thank you, Michelle.
You're welcome. Thank you.
So, and now going back to memory, studies have shown that we have three types of memory. We have the short-term memory, 5-7 seconds of retention, normal memory, short retention of ideas and concepts, and long-term memory. So that's the memory that we retain, that we remember when we were little and what we used to like and games we used to play and so forth. Um, but we interpreters, we use all of these memories doing our work. But the short-term memory is the only one that can be improved in a short time. Nor normal term memory could be extended a few seconds longer. And long-term memory involves the study of something for a long time. So we like to work on short-term memory because that's the one that we use the most. So I like to give you these tips for memory retention so that I'm sure all of you do this already, and this is just a reminder of how how we work. But concentration and going again to the focus on mindful meditation that really can help us with concentration. I also have a handout there. Hopefully you can see it, and it's called Improve Your Memory Skills. In there, I've included some examples as to how we can do this next memory retention. For example, in the handout, I tell you that we need to concentrate and we need to focus on the meaning and not the words. Like I said before, sometimes we interpreters come across a word that we don't know how to say, or we forgotten how to say it. So at least we can say the meaning. Of course, always being transparent and letting the provider know what we're doing. But we need to focus on the meaning and not the word. For example, here we have a doctor that told us to tell the patient, oh, well, that's the way the cookie crumbles. So how do we say that in our language, Spanish, Chinese? Are we going to say that the cookie is crumbling? Or are we going to say, well, that's the way things are? So we have to focus on the meaning of the message that we're receiving, not so much in the words. Of course, if it can be if it can be interpreted literally, it can. But otherwise, as long as you give the meaning, we call this in our field we call this paint the word picture because we're transmitting the message. Also, another tips is visualizing, running the video in your mind. Sometimes just hearing and just imagining and just playing it out in your head as to how it's being said. Another good thing for memory retention is echoing. So repeating the key words in your mind when you're listening, like hand, head, liver, gallbladder, all those heavy, dirty terms that we sometimes hear. And so repeating them and visualizing where they are, what they do, and so forth, will help us remember. Another thing that can help us is counting. Sometimes a lady will have 5 children, and she will say the name of her 5 children, Peter, John, Mario, Jorge, Rafael. So she said 5. So when we're repeating the numbers, the names, we have to make sure we repeat it 5. And if we only came up with 3, we can say, Oh, I'm sorry. Did you say Peter, John, and Jorge? What others names did you say so that at least we can repeat what we heard because it's important to acknowledge when we don't remember so we can at least say what we remember. So counting will help you remember how many things were said. Of course, we'll deal with the note taking, but writing down dates, times, phone numbers, addresses, and medications. I really want to emphasize writing down times, phone numbers, and medications. When I mean medications, I mean, for example, sometimes as we interpret, just an example, we have to give Coumadin values, and let's say I'm doing over the phone interpreting, and the clinic will call and say, "Hi, Mr. Martinez, I'm calling to give you your Coumadin values for today. Um, your Coumadin is too high today, so your Coumadin level is too high, so your uh, I'm going to change the dosage for the next 5 days. So tomorrow, Friday, you will take 2 pills in the morning, and then on Saturday, take 3.5. On Sunday, you take 2. On Monday, you take 1.5. On Tuesday, you don't take anything. On Wednesday, take 2. And then on Thursday, come back to clinic. How am I going to remember all those important values for Mr. Martinez if I don't write down what I'm hearing, and I don't check with the clinician and say, "Excuse me, did you say that on Thursdays he takes 2 and on Fridays he takes 3," or whatever the amount was? Then we may really hurt this patient by giving him the wrong instructions. So writing down numbers is of the utmost importance. Also, times, like for example, they say, "Come back on May 11 at 11 a.m." Well, I will get confused if I write 11:11. I will have to write 5:11 and then 11:00 for time. So writing down times extremely important, and also phone numbers. Let's say that they're saying, "Well, call the clinic at 925-268-9754." We may remember it right then and there, but if she says repeat it, we can't. So writing down numbers, very, very important. The next one is note taking. I've included in the handouts some symbols that I think could be of use to you when note taking. So I just came up with this, but there's so many. You can make your own signs, and we'll deal with that as soon as we get to the note taking part. So that's pretty much on that. And so we already did our exercise, but I'd like to ask you and to ask yourself, how good is your memory? I like to leave you with that question as I close my memory presentation. And I'd like to encourage us to keep our memory sharp. And I think I have heard people say as we get older, our memory decreases. I noticed that in myself a little bit, but I try to keep my memory sharp because this is a tool. This is how I make my living interpreting. So I need to have the best memory and note-taking skills possible. So that will conclude because we already did the group activity. So I think that will be, what I have. We already did the faithful echo, which was the exercise we did. So thank you, Michelle, for putting the next presentation. And I don't know if you want to do the next presentation. Do you have it in your screen? Hello, Michelle?
I'm
Hello.
here. Yes, I'm here. Sorry. I was just,
No, sorry.
I'm getting it all here. And so, yes,
Okay.
if you want to go ahead and change presenter over, I'm getting this set up so that
Yes,
I have
you
it
are
ready
there.
here. And again, just give us a moment here to to get everything adjusted. I should be ready here to show you the presentation. Do you see that now?
Yes, yes, thank you so much.
You're welcome. And just tell
So,
me when you're ready to change each slide then.
yes, got it. I appreciate it. So, I think that what we like to talk about now is note taking. Now, note taking is a skill that we develop over time. And so I'd like to direct you, if you can, to see the note-taking tips that I've included in the handouts that I provided. First of all, when we're doing notes, don't try to write everything down because you'll probably miss something, and that will increase the likelihood of our errors. There is a better way to this. Develop your own system of shortened words and symbols. I've included some symbols for us. However, I think developing your own would really help you because since you developed them, it really would be to your advantage because you remember. Now, I'm sorry, Michelle. Let me see if am I able to move this up and down, Michelle? I'm sorry.
No, I would need to do that for you. You mean to move the slide, to change the slide?
Yes.
I will do
Yes.
that when you're ready. Just tell me each time to go ahead and just say change slide and I'll change it for you.
Okay, so going back to these ones, a notebook or loose sheets of papers or whatever works for you, you will decide. It will depend on your needs as to what kind of what do you use for note taking. Also, it depends on where you are and are you doing over the phone interpreting? Are you in the clinic taking notes or what is where are you at the time when you need to take the notes? In my opinion, a notepad is the best option. But whatever you choose, make sure that at least it meets one of these requirements. Can you move it? Uh, so make sure that you can write anything quickly and easily, and it will allow you to review and interpret your notes quickly. It's happened to me before where I write so fast that I cannot read my own writing. It's happened to me several times. So when we are writing, make sure that we don't that we all can understand what we just wrote, and also in a way that is easily found. Go ahead. Thank you. So here's a general suggestion when you're taking notes. Avoid taking notes all over the place. I've been teaching interpreting for quite some time, and when I do this, I see interpreters that will write a note in the corner, another note in the other corner, and they have it all over the place, and they don't have a sequence to their notes. So stay place as you're taking the notes. That way you can go back to them. Do not get stuck on the individual words that can distract you from hearing the words that follow. I recently had a student that told me that she wasn't able to pass her CHI spoken exam because she was stuck taking notes. And she said she got confused and she got distracted, and therefore she was unable to complete the second portion of the CHI test. And so that got me thinking that I needed to really polish this up a little more and let people know and my students that they don't have to write everything. You just have to write what is the main idea. So do not let note taking interfere with listening attentively. So, for example, if the doctor says, "Well, Mrs. Martinez, your tumor has grown and is now to the place where we need to give you radiation, so we need to shrink it, and then we can do the surgery." And so having to take notes on this, we don't have to write, well, we need to write tumor is large, treatment, and then shrink those words so that we can remember and give us ideas or give us pointers as to how to remember the message. And I've seen people that want to write the whole thing. Um, so do not let note taking interfere with listening attentively. Take notes in a relaxed and organized manner. Write clearly so that you can read your notes easily, and then take notes vertically from top to bottom on a piece of paper. Thank you, Michelle. So taking notes is not the same as writing. So we said this already. We're not writing, we're just taking simple notes. It is not about shorthand. Some of us may know shorthand, and I don't know if they still teach that, but shorthand really worked, but you really need to know how to read your own shorthand. So it's not shorthand. It's about getting the most relevant ideas or proposals, what concerns, or things that concerns you and things you may have to do. So when you take notes, you must first listen, filter, and choose. So you choose what is the most relevant idea of that sentence that you need to retain so that you can repeat it accurately. The key to this is to be very attentive to the speaker for what is being said and how it's being said, and then for moving, and especially where there is emphasis being made as well as pauses. An example, for example, the doctor is saying that she has a gallbladder and needs to have surgery in the next 3 days. So we need to make sure that we write the word 3 days, surgery, gallbladder, but we don't need to write, you need to have surgery in the next 3 days. Just write the most relevant things. It is essential to decide what contents are most important in order to highlight them in our notes. Thank you, Michelle. So process the information sentence by sentence, not word by word. So listen attentively to what you just heard and then decide right then and there. Identify the main idea, write down the nouns to help you remember the main idea. Make sure that you understand the meaning of the entire sentence before you start interpreting. When I started interpreting for over the phone many years ago, I had to interpret for companies that were fixing computers, and I had no idea what they were talking about. I was actually just repeating, but I had no concept of what they were saying because I'm very challenged by technology. I had never fixed a computer before. I had no knowledge of how the computer worked. And here I was interpreting from a client back in Chile, Santiago, Chile, for a company here, Dell, explaining to the client how to troubleshoot their computer. But I was just repeating like a parrot, not understanding anything of what was being said. And I was taking notes like crazy, trying to understand what they were trying to say. So it was very hard to grab the main idea because to me, everything was the main idea. So really having knowledge of what the topic is that's being presented, those help us also to choose what notes are we going to take. And so make sure you understand the meaning of the sentence, and then mark unfamiliar words in your notes to explain them, always with the provider's knowledge and consent, so that if you don't know the most precise way to interpret them. Thank you, Michelle. Do not try to take notes on everything. Only write down the most important. I cannot tell you enough how important this is because I've seen people trying to take notes on everything. So always write down factual information, such as dates, names, numbers, as we said before, and only take notes to help you recall what was said quickly as an aid to your short-term memory. Remember, we said short-term memory is the memory that we can actually help improve. So these are only an aid to help our short-term memory. Thank you, Michelle. Now, the symbols and abbreviations, I'm hoping that by now you may have been able to look at some of our handouts. I have included 3 handouts on notes. So not everything that you write down in your notebook has the same meaning or the same importance. So you can distinguish it easily with a symbol. And I'm hoping that you will have your handouts, but one of them is called chunking. Are you familiar with chunking? Chunking is a technique that organizes information into a more manageable units. The example that I have included is it helps us remember it in 4 chunks. So that, for example, we're having to say a phone number. And so the number was 1-800-447-8477. So it is 11 digits. So by going one by one, 1-800-447-8477 will help us more remember. Now, for those of you that do over the phone interpreting, you will know that we do a lot of phone numbers. We have to repeat a lot of phone numbers, social security numbers, ID numbers, policy numbers, and sometimes when they call and the agent says, I need your 16-digit credit card number, the numbers on the back and the expiration date, and your date of birth and your phone number and your address. All of that sometimes is in a single phone call. So knowing how to chunk the information or how to organize it will help us deliver the message and not having to stay with the same sentence 3 times and give back the wrong information, especially with those long credit card numbers or the policy numbers. Sometimes our clients or our patients, they don't know or they cannot see the numbers well because they're so little. So they're telling us, no, I think I said a 5. Oh no, I think it looks like a 6. Oh no, I think I gave you the wrong one. So, just trying to know what to do when you come to those situations is very important.
Lourdes, I have these open. I just thought, is this the note-taking tips? Is that the handout that shows the chunking?
Yes, it's actually also on the improve your memory.
Okay.
Yes. Yes.
I'll show this real quick here, and just show everyone this handout so that it gives some really nice suggestions of what you're talking about. And I will also, here is the symbols handout that you're going to be describing as well. So just to make sure that everybody knows which 2 handouts from the group that we're looking at.
Thank you. And since you're in here, very important. I think when it comes to notes, where you have to follow the policies and protocols of wherever you are. For example, there will be some places. As a freelancer, I started freelancing about a year ago. There are some places when I take notes, the doctors or clinics, I need to let them know I'm taking notes so that I can do it better. I can render the message faithfully. Sometimes they may want to know why, so this is why I explain it. And in some places, they will want to keep your notes, and in some places they don't care. But I usually destroy my notes the moment I'm done with my notes. If I am in a clinic or in the hospital, I destroy the notes immediately. Of course, if you are doing over the phone interpreting, you must destroy the notes immediately. We're not allowed to retain notes, especially if we have recorded social securities or account numbers and such, our policies are there that the notes get destroyed as soon as they're taken, so that to ensure confidentiality of the patient and so forth. So just wanted to mention that. Now the chunking, I don't know that we've seen it so far, but it's in the note taking tips.
I've just put it up. It's
Yes. Oh,
in the memory
there.
skills there. Yeah. The memory skills
Thank
come
you.
up. Hmm.
Yes. So it's, if you can see here, these techniques really helps us organize information into more minutes. And this also works with those long, sometimes, the policies numbers, when there's a car policy number or a homeowner's insurance policy number that we need to interpret. Sometimes there's so many that going by this will help us more. So also I have here this other example that says, let's divide. Chunking may be used for whole phrases. For example, good afternoon, Mrs. Liu. Please step onto the scale so we can take your weight. After this, you will go to exam room number 3, where you will take your blood pressure and do an EKG. Let's divide this message into chunks to make it easier to remember. Now, so good afternoon, Mrs. Liu. Please step onto the scale so we can take your weight. The third chunk is a bit too long, so we'll divide it into. After this, you will go into exam 3, where we will take your blood pressure and do an EKG. So you see how this phrase here got divided into 3, and it was a lot easier to repeat and remember if we chunk it like this. I don't know if it makes any sense, but as you look at each of these, you will notice the concepts and how each is made. This is a commonly groups of series of words. Take your weight, go to room number 3, and I will take your blood pressure. Because as we said earlier, we can, run the video in our mind. And since if some of us are seasoned interpreters, we know, we've seen this, we've done this many times. So we visualize this in our mind, so it's easier to remember. Because if we forget to say, I will take your blood pressure there, and then they take the patient's blood pressure, she will say, oh, they didn't tell me that they will take my blood pressure, So it's so important to remember anything. Nothing is frugal. Everything is important. Because if they spoke English, they will hear everything. So that's on the note-taking tips. Sorry, that was on the improving your memory skill. So thank you. Going back to the symbols and abbreviations, just write something that helps you interpret so that you will read it easily without having to really go to your notes and say, oh my God, what did I write? And so can you go to the next one? Thank you. Use commonly accepted abbreviations. For example, HR for hour or RX for treatment. Other abbreviations only if they have the same meaning to you. For example, I've seen interpreters that will use an abbreviation and they don't remember what was the abbreviation for, what was it? And so make sure that when you use an abbreviation, you know what the abbreviation was for, and use the same abbreviation all the time to avoid any possible confusions. Don't use today this one for hour, and tomorrow you use a different one, and the next day you use a different one, because then you may not remember. So just I wanted to advise that we stick to what we know to help us remember. Can you move? Thank you. Thank you. Think of symbols that will bring the meaning to mind quickly when you are interpreting from your notes. If you are a very visual person, quick sketches or drawings may help you remember information. With this, I mean maybe a sad face for pain, or a happy face for good news, or a line for, come back in 3 days, or whatever symbols may help you remember what you said or what was said. This is very, very important, but always symbols that you are familiar with, and don't come up with the symbol right then and there as you're interpreting, because maybe at that time you meant to say this, but then when you're looking at it, you don't remember. I've seen plenty of interpreters trying to take notes and then trying to say, "Oh my God, can you please tell me what you said? I seem to not remember," or they got distracted with new symbols they were creating and the messages went by them. The next one, please. Thank you. So use arrows to indicate relationships between things and people. And this is, of course, only a suggestions. For instance, if the doctor tells a patient to have some lab test done, it can be indicated in your notes by drawing a horizontal arrow to the word lab. So as opposed to writing go to the lab, just a little arrow to the lab. That will make your mind remember that they need to go to the lab. Also, putting a line underneath the word of a phrase that was emphasized. For example, in the beginning, I remember I used to have a lot of problems remembering right and left. So if they say right inguinal hernia, I will forget that they say right and I may have said left. So I always put emphasize, because I know I had that problem. I will emphasize right and I will underline it. I also would put my right hand on my right leg, or so that I will remember we're talking about the right, or vice versa, we're talking about the left. These mistakes are very common. People sometimes will say right for left and left for right. And so it's very important to really, if you know you have trouble with something, to really emphasize for yourself so that you can render. Some people also have troubles with the 6 and the 9. They will write a 6 instead of a 9, or vice versa. So if you know you have that trouble, underline the word and really write down what you need to remember. There's nothing better than knowing yourself and knowing what you lack and what you need to emphasize, so that we can render the best, we can do the best rendition of the message. Remember what I said in the beginning, the trust that was placed on us by the patient and provider, and that is very important, because when we don't deliver the message as it was given to us, it does violate the trust that was placed on us. So I always am a firm believer that note taking can really help keep the trust intact. Can you move to the next one? So this is a system that I sometimes have when I don't have a notepad with me. Just sometimes there was nothing, and they give you from the copy machine, they give you a 8.5 paper, and so just so that you don't have the whole page to write on, develop a system consisting of quadrants. You can fold it in 4 and make it like a little notebook. That will be a way that you could take notes in a hurry if you're finding yourself that you didn't have a notebook. And so that will be a way. And also you can do this quadrant exercise, where in the quadrant 1, questions from the provider, in the other page, question from patients, in the quadrant 3, medications, and in the other one, information. Now, this, I need to warn you, could be very complex and confusing if you're not used. So only do this if you're very familiar with what you're interpreting, because if not, what may end up happening is that you may be confused as to where something goes. So I always like to include this because this is I would say, the ultimate note-taking guidelines, if you will. But it could be confusing if we're not used to doing something like this. But if you know how and you have enough experience with this, it works beautiful, because you then know what the provider says, what the patient said, and so forth, because you have divided it into 4. Is there a next one? So with a single quick look at your paper, you will know the issues were brought up during the session. So this is why this is a very good way of taking notes. But as I said, it might be distracting if you're not used to this method of taking notes. I wonder if there's another one, or you can keep segments separate. And once you have interpreted something, you can begin to take notes on the next segment. Something that helps me when I'm using this is I cross out what I've already interpreted so that I don't think that I haven't said it, so crossing out. Another option for separating segments is to put a diagonal line through your notes so that it will alert you that you already finished interpreting that, so that you can begin taking notes on the next sentence. Write on only one side of each page to avoid confusion. I have seen people get confused with the notes they just took, and some people give up altogether taking notes because they're saying it's very confusing, when in fact, instead of being confusing, is an aid to the interpreter. So I will encourage us, if we don't take notes already, to at least start practicing. It will really alleviate some of the stress of having to remember everything, especially if there were too many details on the phrase that we just received. Can you advance? So review your notes immediately, and this is on my closing on the note taking. Taking notes is useless if you do not refer back to them. So if you're taking notes and don't go back to them, it's useless for us, which is exerting time that we could be using in listening. So read as you use them, utilize them. It will make your job easier. I couldn't interpret right now if I didn't take notes. So taking notes is essential for us interpreters. So I just have a few minutes on my closing, but I'd like to please ask you to, when you can, read the Walking Mindful Meditation. Sometimes people are in a hurry when they're interpreting. They have a lot of things in their minds. They didn't sleep well the night before, or their pager went off as they were interpreting, or there was a loud noise behind them. All kinds of things can affect as we are interpreting. So practicing mindfulness in an everyday life can really help us to focus on what we are doing. So being in the present, completely being in the present. So if we are interpreting, just have our mind in what we are doing. And just reading from the last sentence of the mindfulness handout that I provided, it says, practicing the power of now is woven throughout your day. It doesn't really matter how you focus or for how long. What matters is that you train your brain to attend to the present moment, which is all that we really have. So being in the present, sometimes people are thinking as to what happened, 10 minutes ago, why did I do that? Why did I not say this? Or what will happen in an hour? Oh my God, I need to see this and that. So just being present to what we are doing right at the moment is what really will help us also do the best job possible. Remember, the present is all we have. We're not in the future yet, and we're not in the past. The past is gone. So what we have is a patient, a provider in front of us that are depending on us doing the best job possible with accuracy and completeness. And practicing mindfulness can really help with note taking and memory. So that's how I wanted to close this and go to the next session. And I hope you really can read these handouts. I think it may help you. And please share them with your colleagues if you would like. Michelle.
Thank you, Lourdes, and I apologize for closing out the PowerPoint a little bit prematurely before you were done.
That's fine.
But I do have now up the website again, the YouTube channel, so everybody can see that, and just be reminded that the recording will be available. I've had a number of questions from participants wanting to know about the handouts and if those are going to be available after. Some people may be joining by phone or just not able to see how to download those handouts. So if you do need to have those handouts following this presentation, you can send an email to our chair of the CHIA Education Committee, Miss Beverly Truman, and the email address for Beverly is info@chiaonline.org. That's CHIA online, ONLINE.org. So quite easy. And if you need to go to if you go to the CHIA website, chiaonline.org, you can find contact information and email addresses there as well. So just to move on then for some questions here that have been asked. Actually, I want to go back. There was a question going back to the memory section of your presentation, Lourdes. And
Yes.
the question was about any links or resources for the echo technique that you mentioned. So you did provide the handout that I believe shows demonstrates that technique. Are there other resources available?
Yes, there are. And I actually have some websites that I can include and I can send them to you and maybe they can access them a little bit later today. There are some I would say the echoing, something that has helped me through my years of interpreting is called the shadow interpreting. And with that I mean is that when you're in your car or you have a program that you really like and you hear that program is say in English or your language and then you interpret that into the other language and that develops speed and accuracy. And so I would say that's like the echo part of just practicing that echo. Also repeating, for example, we had this word tetralogy of Fallot, that's a very complex medical term that sometimes people have trouble with, and which is found in all the tests that we take for certifications. And sometimes people cannot remember what that means, but if they actually think of the word tetralogy and now they understand that tetra, means four now. So tetralogy, so now we have an illness that has four things. So now we're already doing an echo in our mind, making our mind really work to understand that term. So I can send some links so that to practice more on the echo and help us remember some of those techniques to better our mind and not get confused when we come to a term that's unfamiliar to us and we get nervous and then we forget the whole sentence. I don't know if that makes sense.
Yes, perfect. And so a lot of interest here coming through on those links. And I think what we could perhaps try to do is when those certificates get sent out to all of the participants, we will be emailing the certificates of attendance. And perhaps at that time, we can go ahead and send those links out as well. How does that sound?
That sounds great. I will come up with several. I should have included, but you may also want to mention the YouTube that I sent you about the brain, that YouTube presentation on the language of the brain and how the brain absorbs language.
Excellent. Yes.
And I,
We can include that link as well. So that was something that we can't really show easily on online, show the video itself, just because with the webinar platform it doesn't work all that great, but we'll make sure that we can send the link. And in fact, we can also save that link to the CHIA YouTube channel. So even though it's not a
yes,
CHIA video, we can actually put that in our playlists, and that way it'll be nice and easy for everybody to look at as well.
that's great because that YouTube video is on brain mapping, and brain mapping now, it's exploding. There's so many videos on that, but we came across this incredible video on brain mapping, and it will really explain also how language works in our brain, and it will help us understand and help us with retention as we listen and have to interpret.
Excellent, excellent. So now, there was a question about whether or not there's a specific vocabulary for note taking, or does the interpreter make up their own? And I think you explained that a little bit, as far as there may be some standard symbols, but I think what you were trying to say is make up something that makes sense to you. Is that correct?
That's correct. And I also have another handout that has more symbols. And, we can learn the symbols and use them. But sometimes if we haven't learned them correctly and we remember it that one time, but then we go back and then we don't know what the symbols are, I like to create my own. Of course, there are some standards that we all know and that we can use. However, creating our own sometimes will help us remember even more. But I definitely have a paper with several symbols that can maybe help us. And Miss Cindy Roth has that book on, I forget the bit tips for interpreters or something like that, where she has a whole chapter on symbols and note taking and so forth. So I will include the name of the book in case, because that book is really, with all due respect, but it's a Bible to interpreters. It has so much on note-taking, memorization, positioning, eye gazing, or body language, all kinds of things that can really help us. So maybe we'll include the name of that book by Miss Cindy Roth.
Excellent.
It really can help.
Sure. I think
Yeah.
any resources will be welcome. And the next question is saying that the participant says she's noticed that for workers' compensation appointments, a lot of times the doctors are trying to keep the phrases very short and trying to get the appointment done quickly. Do you still take notes for those types of appointments or those types of interactions?
I do a lot of workmen's compensations appointments. In fact, I did that one yesterday afternoon. And, I really, my heart goes out to all of us that do workmen's comp. We come across so many doctors that do so many things that are completely unreal. And as I do take notes, and depending on what, and yes, sometimes the questions are very short, and many times the doctors don't even speak to the patients. I had appointments where the doctor never said a thing to the patient. He just read these papers and he said you can go, and other times they don't. But I would say that you still take notes if the sentences are longer, but always with the knowledge, always letting the provider know, doctor, I'm taking notes just to help me remember. I'll be glad to turn over my notes when I'm done. So it really depends on how short the sentences were. Sometimes you don't need to remember because they're so short, and how did you hurt yourself? But when I take notes, for those of us that do workman's comp, is when the patient is saying, because sometimes they're explaining how they fell, or how they landed when they fell, and sometimes they're not very clear, and they will say that they bounced this way or they bounced that way, and they hurt their shoulder as they were falling on that side, whatever. So I take notes for that to help me remember what the patient said, because sometimes the patient's answers are very long. So I take notes on those occasions, always with the knowledge to the provider that I'm taking notes so that I can remember better.
Super. And we've had some comments come in. The name of the book is Healthcare Interpreting in Small Bites by Cindy Rote.
That,
And
thank you. I appreciate it.
it's available on cindyrote.com, and that's CINDYROAT, cindyrote.com, and it is also available on amazon.com. So the
Yes.
next question then, actually a few people have commented about the language of the notes. So we have one participant who said that he goes back and forth between languages, just whichever one is faster for him to write in the moment. But what is your feedback on that? So we've had some questions. Should you stick to one language or another when you're writing those notes?
And I like to refer back to what you said about the bilingual brain. Those some of us, have had interpreting for a long time. So I would say you take notes in whatever language is easiest for you. I find myself, taking notes in my language and in English at the same time. And I'm not sure if it's good or not, but to me, because I've done this for so long, I go back and forth between my language and English. But certainly, if I'm doing English, the doctor is saying gallbladder, liver, inflammation, stones, and so forth. So I will just write it in English because I have to repeat it back in English. Um, so it really depends. I think sticking to the language that you're listening to might be best if we haven't had a lot of practice.
Very good, very good. And so I've been asked to repeat the name of the book, Healthcare Interpreting in Small Bites, and that is by Cindy Rote, CINDY, last name Rote, ROAT. You can look for her also, I believe, as Cynthia Rote, CYNTHIA, if you want to look at other things, because that's not the only publication that Miss Rote has as well. So our dear colleague. So we're about at our time for wrapping up here, and there have been some other comments and suggestions that have come in, and we do appreciate that. We've tried to answer as many as we can, but if we haven't been able to answer your question today, or if you have any other questions about how the process works, their certificates, upcoming webinars, etc., again, we encourage you to send an email to info@chiaonline.org. And our lovely chairperson for the Education Committee, Ms. Beverly Truman, will be able to answer your questions or send you to the correct person that will do so. So having said that then, we are going to go ahead and wrap up. And Lourdes, this was a great presentation. Thank you so much for all of the information. I'm sure this is much appreciated. It's a topic I don't think gets covered enough. And we've had I mentioned at the beginning that we had over 100 individuals. We've had over 200 people on this call. So thank you to everybody across the country, actually, not only in California, who has joined us today. And we've got 18 subscribers on our YouTube channel, so considering that there's over 200 attendees on the call today, I'd like to set a challenge out to everybody today to please subscribe to that YouTube channel, and let's at least get 100 new subscribers over the next week or so, or at least before our next presentation. That would be really great. So again, the recording for this presentation is going to be going up on that YouTube channel later this afternoon. It will be ready, and you can either review this yourself or feel free to share the link to that to the presentation, to the recording with any of your colleagues. And you will have 2 opportunities as a reminder to give us feedback on the webinar. The first is that immediately following this webinar, an evaluation will pop up on your screen. If you have a chance to do that evaluation at this time, that will be great. If you don't have time to do it right now, simply wait until tomorrow and you will get an email with a link to the survey. So if you do complete it online following the presentation, you will still get the email. So that's just something that happens automatically. We appreciate you, filling that form out one way or another. So we will process the certificates of attendance as soon as possible. Like I said, we've got now over 200 people to send those certificates to, so we do appreciate your patience. We're a volunteer board. We do have volunteers as well, so if you want to hop on board and give us a hand with those certificates, we will gladly take your assistance. But we do ask you to please give us 30 days to get those certificates out to you in the email. You do not need to send us a request for the certificate. We will send those certificates out to everybody who has attended the full session today. We invite you to our next webinar. We're very excited to have Diane Moradian presenting Turning Your Thermostat Down, Preserving Emotional and Physical Energy When Vicarious Trauma Sets In. That webinar is going to take place on Thursday, June 9th. Diane is a psychologist. She presented this topic at the CHIA conference recently in March. And I had the pleasure of attending that session, and I can tell you it's an excellent session. This is a topic that's related to self-care. So as we know, interpreters have very stressful working situations, and this is one of those presentations that really helps you think about self-care so that you can do your job better, but also just feel better yourself and be probably a lot nicer to everyone around you. If you're interested in presenting a webinar, we do look for presenters. So if you're a trainer and have a topic that you would like to present, you can send your topic and your CV to info@chiaonline.org. So with that, we are concluding today's webinar. Again, thank you, Lourdes, and thank you to everybody who has joined us today. We look forward to seeing you next month. Bye-bye.
Thank you so much. Thank you. Bye-bye.